my name's Claire Sharp. I'm a specialist in small animal emergency and critical care at the Animal Hospital at Murdoch University. My job here at Murdoch involves looking after sick animals in the small animal emergency room and ICU, teaching veterinary students, interns and residents, and doing research in small animal emergency and critical care. One of the things that brought me to work at a university is that I love teaching and learning in the veterinary world so that we can all get better at looking after our patients and the families that love them. In our patients in an emergency and ICU setting, we use an asset-based analysis using the Alinity on at least a daily basis. This is particularly with our patients that present with abnormalities of their acid base or electrolyte status at the time of presentation. But even for our more routine hospitalised cases, serial monitoring of electrolyte is very important. Essentially, for any patient that we have on intravenous fluids, monitoring their electrolytes at least once daily is vital, and the electrolyte and acid-based component of the iStat panels will help you do that. Evaluating acid-base status with a device like the iStat Alinity using multi-parameter panels can help us assess all aspects of our patients. So the iStat Alinity uses ion-specific electrode technology, which is the most accurate way to measure electrolytes. So by getting a very accurate representation of the patient's electrolyte balance, we can pick the most appropriate fluid and also know how to supplement that fluid with things like potassium to make sure that we can replace what the patient has lost in their vomiting. When a sick patient presents to us, we'll often collect a blood sample to use in the iStat Alinity immediately when we place an IV catheter. The volume of blood required is very small, and the whole blood can be transferred directly into the iStat cartridge, allowing results in minutes. Practically before we even have an IV catheter secured, we have our blood test results back and we're able to use that information to assess and treat our patients.